The following paid program does not necessarily reflect the views of this station, its staff, or Clear Channel Media and Entertainment.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedic, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome back to The Moving Body. This is a live show. The previous hour was not. Today's date is May 10th, 2014. I say that because one time in the future, this show will not be live. It'll be repeated. That's how we do it. So today, Saturday, May 10th, you can call 521-8383 and ask me anything you like about arm, leg, neck, or back pain. I'd be happy to do my best, as I always do, to answer your questions. If you're calling from Neighbor Island, you can call 1-888-565-8383. And we have an hour together and hope to have some fun and teach a little bit and help people a little bit and learn interesting things about each other. The show sometimes takes very interesting turns all by itself. I've been doing this show since 1989, and I have to say that the show has taken on a certain life of its own. And I'm very happy about that. I am now a player in it rather than the main guy. So 521-8383. And I want to make a little announcement. This is very rare for me. I actually have an advertisement. I have a good friend, Dave Bernstein, who's a lawyer and plus a lot of other things, father, accountant, computer wizard. But his area of law is wills and trusts, and he's asked me to announce that he's having two free seminars on Oahu in 2 weeks, Saturday, May 24th, from 10 to noon at the Wailea Country Club, and at the Ala Moana Hotel Sunday, the next day, May 25th, on Atkinson there, Ala Moana Hotel. You should call for a reservation, although I think you could probably show up. 533-3243. It's on wills and trusts, estate planning, and it's very, very important. Nothing is sold there. This is for information, but the whole idea is to avoid probate, isn't it? Probate is the court that you have to go to when somebody in your family dies and they have left some assets, money, a house, who knows, stocks, and never provided a legal document to state his wishes. And a probate's very expensive, time-consuming, and a big hassle for the kids and family left behind. If you don't have a will, it's a good thing to go to this seminar. And I give my personal endorsement to Dave. He's very trustworthy and smart. So there you go. Get a pencil and paper, and I'll announce that number and those times and everything later on in the show. I see I have a caller already, Jennifer. Jennifer, go ahead. You're on the air, and thanks for calling.
Hello, my name is Jennifer, and I am having a problem with my left Achilles tendon. It is, I'm a Zumba instructor in Hawaii Kai, and I teach about 9 classes a week on the outdoor stage, and my Achilles tendon has been bothering me for about 2 months now. And after class, it swells up, and I can't really flex or point my foot.
You can't walk on your tiptoes.
Exactly, or go up or down stairs. Right. I have to have my foot completely...
Right, and it's been 2 months, but you continue to teach, and when you teach, you actually have to do some jumping around?
A little bit, yes, and I'm able to do that without pain while I'm doing it, but it's after that it hurts.
Right. It's going to be, I'll talk to you about Achilles tendonitis and the various treatments, But whatever we recommend, it's not going to work unless you're able to cut back or cut out the activities that bother it. And even though while teaching you don't feel it yet, you feel it later. And clearly bouncing and jumping is tough for the Achilles. The Achilles tendon is a very powerful tendon. Everybody listening knows it connects the calf muscles to the heel bone and allows you to stand up on your tiptoes. But every time we take a step, our back foot pushes off, and that's the Achilles. And the problem with the Achilles tendon, really, for everybody, is that it has a very poor lever system, which will be hard to describe. But imagine lifting up a 2x4, 8-foot-long 2x4, lifting it up from its end. And the Achilles has to sort of push your foot up with the same sort of disadvantage of a lever system. Not exactly like that, but that's the best example over the phone. So there's a lot of stress. It's probably about 4-to-1. So if you weigh 150 pounds, the Achilles has to have 600 pounds of force to rise you up on your toes, if you can imagine that. And usually it's no problem. I assume you got this gradually over time. It's not like you suddenly felt your Achilles hurt.
Exactly.
Yeah, it was a gradual thing. This is called the overuse injury. In sports medicine, and Zumba can be considered a sport, exercise. So in sports medicine, there's basically two ways of getting injured. One is suddenly, you're playing football and someone tackles you from the side and you bust up your knee, or you come down playing basketball and twist your ankle, and that's a sudden sports injury. And then the other kind is like the one that you have. It's a gradual onset. It's called overuse. And the treatment for Achilles tendonitis or any overuse injury is, first of all, avoiding the activity that causes it to hurt, because every time it hurts, it's not just hurt, but it's harm. And what I mean by that is Achilles tendonitis is, on a microscopic level, the breaking of tiny protein fibers called collagen. So under a microscope, you would actually see these fibers, fibrils, because they're so small, actually torn. And if it hurts, it means it's tearing more. So when you're not hurting and you're resting, let's say at night, you're healing. Your body is trying to heal it, and it's healing, and it's healing, and it's healing. And then you wake up in the morning, and it's a little bit healed, but obviously not all healed. And then when you go teach your 9 classes, then it tears a little bit more, and you go backwards. So in order to really have an effective treatment plan, it's got to include the avoidance of the activities that hurt. People with bad Achilles tendonitis, that they hurt even when they just walk on flat ground. Do you?
Yes.
I put them in crutches, because with crutches, you can just put partial weight, and after just a few days, you'll be able to walk without crutches and without pain. So the key is to avoid pain. As far as treatments go, otherwise, besides changing your activities, there's a very good treatment called friction massage. It's an old-fashioned, hundreds of years old treatment, and it's still very effective. And it can be used. It's done about every other day for 10 minutes. You have to have a physical therapist who has experience in doing friction massage. Not all therapists are the same. And it's usually done maybe just 3 or 4 times. Various exercises, rehabilitation will be important a little bit later. Rarely, when rest and medicine and friction massage and exercises don't do the trick, then we sometimes give an injection, not so much in the tendon, but around it, of cortisone. And then you really have to stay off it for a while. Occasionally, that doesn't work. And now we're trying a new treatment with what's called PRP, platelet-rich plasma. You may have heard of that. A lot of famous athletes on the mainland have made it quite famous, and I have started doing it here on the island. So, and that's not cortisone, so it has that appeal, and it can be very effective. But basically, you have a tendinitis, which is a microscopic tearing of the tendon. It needs to be treated very carefully with avoidance of the activities that hurt, friction massage, and then rehabilitation. And beyond friction massage, like I said, some people will need injections. Rarely, and I don't know that I've had one patient in 40 years of practice, rarely is surgery indicated, certainly not in your case. And this is opposed to a rupture of the Achilles tendon, which is a sudden injury where it's completely severed, like you break a pencil in half.
Right.
And then if the surgeon can be found quick enough, they can reattach the two ends and sew them together, and that's a big deal. That's not you.
Right.
But that's what I have to say about it, Jennifer. It's tough because I assume it's your livelihood, or at least part of your livelihood, to teach these classes. You're going to have to learn to teach them without stressing your Achilles, without being on your toes.
Okay, I will have to. That's what I'm going to have to do. I'm just going to have to not
do it,
and wear like maybe a little brace and just.
You could wear a little brace. I can talk to you more about a brace that would be effective in resting the Achilles, but that's tough over the phone. There's what's called an ankle foot orthosis, and it's made out of fairly rigid plastic. And it'll take the place of you could rock up onto your toes without using your Achilles. But that's another thing. You can come and see me about this if you like.
I sure will. Thank you so much for your time. I love your show. You're
Jennifer,
awesome.
very sweet of you to say so. Thanks. Maybe I'll see you soon.
Okay.
And happy Mother's Day in any case.
Thank you so
okay. Bye-bye.
Bye-bye.
You're very welcome. 521-8383. Give me a call if you have any questions regarding arm, legs, neck, or back. Here's another caller waiting patiently. Al, go ahead. You're on the air, and thanks for calling.
Yeah, I have a problem when I lie down on my back.
And what is the problem when you lie on your back?
I have a difficult time in breathing.
So if you sit up, you don't have a tough time breathing.
Correct.
And if you walk, does that make you short of breath quickly?
No.
You go up and down stairs okay?
Yeah.
And are you a smoker?
No.
Never did smoke.
Right. Never did smoke.
And for how long have you had this problem of difficulty breathing when lying down?
About a week.
Are you
about a week ago.
Are you otherwise feeling fine?
Yeah, about a week ago I fell on my back.
I see. Flat on your back, huh?
Yeah.
Backwards. And that's when this whole problem began?
Exactly.
And what is the problem when you're lying on your back and trying to breathe? Is it pain or just the sensation of air hunger, that you're not getting enough breathing? Is it
pain?
It's pain. And it's pain only when lying down.
That is correct.
Huh. Have you talked to your doctor about this yet?
Yeah, he just says a massage would help it.
Did he get an x-ray of your back or ribs?
No.
Mm-hmm. So,
necessary.
Yeah,
he felt around the back, and he says that's okay.
Are you getting better?
No.
Right. How old are you?
75.
And you're otherwise in pretty good health?
Very good health.
Yeah. Well, I don't know that I can say for sure what this is over the phone. I can't remember hearing this complaint in my long medical career. I graduated medical school in 75, so you do the math. But it's a little bit unusual. I have heard of people having shortness of breath lying down. They have to sit up. But they usually have very serious medical problems like, heart failure or water around the lungs or something terrible. That's not you. When you fall backwards, you could conceivably crack a rib or crack a bone in your back that could hurt when you're lying down and therefore make breathing difficult. Let me get another more detailed question answered. If you lie down and hold your breath, you're between breaths, is it also painful? Or lying down and taking a breath is what causes the pain?
Lying down and taking a breath.
So if you lie down and hold your breath for 10 seconds, it's not painful.
Correct.
And exactly where is the pain, Al? You have me very intrigued now. Where is the pain felt when you lie down and take a breath? Where do you feel the pain? Exactly.
The small of the back.
The small of the back. Down above the waist.
Exactly.
Yeah. Right in the middle or off to either side?
Both sides.
Both sides.
Now, doctor, when I turn, instead of lying on my back, I would lie on my side.
Yes.
Okay.
Aha.
Now, when I try to sit up, rather than sitting up, from a prone position, I will vertically sit up. I put my feet on the floor and use my hands. I can sit up with minimum pain.
Right. So you're telling me that not only is lying down and breathing hurt, but also changing positions from lying to sitting is also difficult.
Yes.
I see. So you've injured your spine or the muscles attached to the spine or the ligaments attached. I can't say. Let me ask you a personal question, if you don't mind. When you did this, did you notice that you had constipation for a few days afterwards?
No.
Good. I asked that specifically because sometimes people in their 70s can fall and get a compression fracture in their back, and that often is associated with what we call paralytic ileus. It causes constipation for a few days. I would do more than just wait it out and get massage. I would have it examined and at least an x-ray taken and find out exactly what this is. It should be, if it was just a bruise or something like that, it should be getting better each day. And you say it's not. And it's not just the breathing, but also changing positions. What about getting out of a chair up from sitting to standing?
That's okay.
Or getting out of a car where you twist and get out of the car?
It's okay.
You just, when you get up from lying to sitting, that's difficult.
Yes. Originally where I fell on Monday,
Yes.
about a week ago,
Yes.
I did have that problem in getting up from a sitting position.
I see. So it is a little bit improving, isn't it?
Yes.
All right. Well, pay attention to it, and if it persists into the week, have it looked at again. You go back to your doctor, tell them it still hurts. Can I get an X-ray? Or you're welcome to come see me. I see you're in Kaneohe. You could see Dr. Fernandez over at the office right there in the American Savings Building. He could figure this out for you if you don't want to come into town.
Yeah. Kaneohe would be more appropriate.
Do you have a pencil?
One moment, please.
Yeah, go ahead. Get a pencil. And I see there's Joy waiting on the phone. Joy, I'll be with you in just a moment while Al gets his pencil. I don't know how long it takes. You know, sometimes I hear a complaint that doesn't sound familiar. And this one is one of those. Otherwise, 99 times out of 100, I've heard the story before. Al, are you back?
I'm back.
596-7300. Don't call that number, I don't think, until Monday. So if you're still sore Monday, call that number, tell them you talked to me, and you want to be seen as soon as possible in Kaneohe. And they'll give you an appointment with my associate, Dr. Fernandez. Okay, Al?
593.
No, 596.
596.
73.
73.
00.
00.
Okay, Al?
I listen to your program.
Thank you. I appreciate that. I'm going to take my next caller. She's been waiting.
How about Shepard? Isn't he there anymore?
Who's that?
Dr. Shepard?
No, he moved him and his family back to the mainland for family reasons. So Dr. Fernandez, who has the same exact background almost as Dr. Shepard, they both trained with me for 2 years first. So Fernandez is a good man. You'll like him. All righty? All right,
Yeah.
thanks, Al. Good luck with this. Let's see. Joy, go ahead. You're on the air, and thanks for calling.
Hi, Dr. Bernie. We're visiting here on Oahu. We are from Kauai, and my mother's with me for Mother's Day. We're taking her to a show at the Blaisdell.
Sweet.
She injured her leg gardening. She got punctured with a branch.
How long ago?
And go ahead.
How long ago was that?
She did this on Monday.
Okay. And a branch of what plant, if I could ask?
I really don't know.
Okay. I'm just asking because certain plants are known to have a fungus that if you puncture, you can get a fungal infection. And is her wound appear infected to you?
Well, it's got a temperature. It's red.
Yes.
And there's an entrance, and it looks like this branch would have gone all the way through the top part of her shin, but it didn't. So it looks like almost like a blood blister.
And is all the branch removed as far as you can tell? There's probably no piece of wood in there.
No. And so we've been keeping it up, and she's been taking some Advil, and we've been she had ice on it. Mm-hmm. We're just wondering if you're in today and she could come to see you.
You know, I'm not in today, but let me ask another question or two.
Sure.
Was there bleeding involved?
Yes, and if we don't have a Band-Aid on it, it can bleed quite a lot.
Even now?
Yes.
I see. And is it the shin right over the bone, or is it in the fleshy part of the leg?
The fleshy part. She said it felt like when the stick went in, it was like going in butter.
Yeah. She should go to urgent care today.
Okay.
And there's one in Waikiki, Dr. Bearhall or Dr. I'm trying to remember everybody's name, but there's a place, it's run by Straub Clinic called Doctors on Call. I think it's at the Outrigger, but you could look it up or ask the maitre d'. Or if you want, there's an urgent care center in Kahala. And I don't think it's alarming. You don't need to be alarmed. She's feeling well otherwise. Is that true?
Yes.
No fever or chills or sweats or nausea?
No.
Yeah.
No, it's just warm on where the...
Right, but a week, it's almost been a week, you see, and if it wasn't infected, it wouldn't be bleeding, it wouldn't be warm anymore. I bet you it's tender to the touch if you push on it. So it's likely that she has an infection there, and let the doctor take a culture and start her on some antibiotics. In the meantime, you're doing fine. Elevate, ice, Advil, I guess. But I wouldn't wait till Monday because how old is your mom?
She's 8. She just had her birthday, 82.
Yeah, 82. And she's in good health otherwise.
Extremely good health.
No diabetes.
No.
I asked that because diabetics are very prone to infection. But I don't think I'd want to wait till Monday because it would be so easy to start some antibiotics if the doctor thought it was necessary and feel better overnight. Okay. And then taking the culture, they can know for sure what's growing in there. But
now, could they do that? Because, like I said, we're visiting. Could they know the culture, take a culture today and have answers right now?
No, you wouldn't have answers for 24 and then 72 hours. But wherever you are, you can get the results. Okay. And they'll probably take a guess, if I'm right, they'll probably take a guess and start her on some broader spectrum that'll cover most everything. So there's a few drugs that we use for skin cuts like this. In the garden, there's certain things in the dirt and on the branches and so on that can cause problems. Also, if she hasn't had a tetanus booster, that might be important also. But they'll take care of her.
She wants me to take a needle and put a hole in.
I wouldn't do that.
Okay.
Yeah, I wouldn't do that because they'll probably do that there, and that's what they'll culture.
Oh, okay.
I'm giving you this advice without seeing her, so
right.
You might show up and they might say, "Oh, that's silly. Just ice it and forget about it." I don't know, but from what you describe, it shouldn't be bleeding anymore, and it shouldn't be inflamed anymore.
Yeah.
Okay.
Thank you so much. You're very appreciated, and you're a blessing to everyone.
Thank you for saying so, and have a happy Mother's Day, all of you guys.
Thank you.
Okay. Bye.
Aloha.
Aloha. Let's see. Yeah, I hate to send people to a doctor on the weekend because it's alarming, and I don't want to be alarmed. I don't want them to be alarmed, but you know, it's so easy for doctors to say, take 2 aspirin and call me in the morning and miss the boat. So this one needed some attention. Let's see. The lines are open now. You can call here 521-8383. Neighbor Island callers can call toll free 1-888-565-8383. And if you have a problem with your arm, leg, neck, or back, a sports injury, a car accident, a work-related injury, and you don't want to call, or you're driving and you can't call, or you're shy, you can call the office probably Monday, and the number is 596-7300. You could call anytime, but you'll leave a message, I believe, on the weekend. We've been open on the weekends in the past, but right now we are short-staffed and we don't open on the weekends right now. But if you wanted to leave a message, we'll call you back on Monday. You can also go to the website, by the way, if you're into going to websites. It's PortnerOrthopedic.com, one word. And you can, there's a patient inquiry, and you can send us an email, and we can also, and with your phone number, and we can call you in the morning. So, PortnerOrthopedic.com. If you just tuned in, you're listening to Dr. Bernie Portner. This is The Moving Body. I'm an MD specializing in non-surgical orthopedics, and here every day, every Saturday at this time, to try to answer your questions regarding muscles and bones and joints and tendons and ligaments and discs and fascia and so on. A couple quick announcements. In a short 3 weeks, we have a new doctor coming to town, Dr. David Bro, and he lives in Memphis, and he often listens to the show, I know, on iHeartRadio. It's a live streaming service where you can listen to almost any show you want in the world on your radio. And I'm just shouting out aloha to David and let you know we're all waiting patiently to have you start. Well, you're the talk of the clinic, Dave. And Dave will be here starting in June, and in August 1st is when we take over. We're moving our whole office, lock, stock, and barrel, to downtown, 1132 Bishop Street on the 11th floor. Great parking, validated, really nice office, and I hope everybody who's seeing me in our town office on Pi'ikoi Street will not be too intimidated by going downtown. I know I used to be, but this is a beautiful office, and we'll be moving there early August is the date. So all excited about that. I wanted to talk a little bit about interesting patient, but I see I have a caller, and I don't want her to wait. Is it Sally? And I asked Sally, go ahead. You're on the air, and thanks for calling.
Dr. Portner, I just wanted to let you know that last Saturday I called to make an appointment for my husband.
Yes.
And no one called, so I on Tuesday.
Yes.
And I got a live person to talk to, and they said they could take the appointment at that time, and they will call back. And do you know that I'm still waiting?
You know, we have a brand new person doing that job.
Oh,
And
no, I just wanted to let you know because
yeah, that's not right, Sally.
maybe someone sabotaging you.
I don't know about it. It's not a conspiracy. you believe there was somebody on the grassy knoll?
Uh-huh.
No. Sally, it's very unusual. You know, I've been so busy lately, so I know most people who call get a call back and get an appointment, but I'm happy you called me.
Yes, because I have in the past no trouble.
I know, and we have a brand new person doing that, and I suspect they they miss a couple. But I want to be able to get your number.
Uh-huh.
But do you want to give it to me now, or do you want to give it to me privately?
The reason is, after I called, see, my husband was suffering with a neck pain.
Yes.
I used Salonpas on it he's feeling better.
Oh, that's good.
So
so you're just reporting. I really, really appreciate that, and I apologize profusely.
On top of that, when I checked your phone book,
yes,
your number is not listed, you know. Were you aware of that?
No.
Yeah, it's not listed. I had to call the operator to get your number.
The operator knew it, but it's not listed in the white pages?
Yes, and in fact, it has a Kaneohe number, but that number is not acceptable also. So you might want to try.
I'm going to check that. Yeah, thanks. You're finding all kinds of glitches in my system here.
Yeah, the reason is, in the past, I have had no problem.
I know. I really am shocked to hear this.
Yes.
But I'll sort it out, and hopefully that won't happen again. And most importantly, your husband's feeling better. So that's the main thing. Thanks for calling, Sally.
Thanks. Bye.
Bye-bye. That's quite embarrassing. And I'll report that to my office manager right away. Let's see. On Maui, Allie, is that the name? You're on the air, and thanks for calling.
Oh, you're welcome. I have a deltoid strain that I got in the gym from a weird angled machine, and it's been about 15 weeks, but it's getting better. But I just wanted to know how long do those things last?
Tell me a little bit more about it. Describe exactly where you're having the pain.
It's in my deltoid, the head of my deltoid.
On the side of your arm.
Yeah.
And when you say the head of your deltoid, you mean up near the top of the shoulder, or
No.
a third of the way down the arm?
Third of the way down.
So where the deltoid seems to be attached to the bone, maybe.
Yeah.
Uh-huh. And this started how long ago again?
About 15 weeks.
Wow.
I know.
Okay, so and does it hurt to use the shoulder to move it?
Not the shoulder, but more like the third of the way down.
Yeah, but you get pain there when you move your shoulder?
It don't hurt when I move my. Well, it does a little bit. But,
does it hurt when you move your neck?
No.
All right. And how did this happen again?
I was on this hammer string shoulder machine, which has a weird grip that kind of goes down, so it kind of forces people's muscles to pop rather than, they're more like bodybuilder machines. So they want, the apex of their muscles to really pop.
Right. So have you seen anybody for this, or you're just trying to let it get better and rest it and get better?
I've been just resting it. I was originally resting that arm. I wasn't doing heavy.
Right.
So, because I had a tendonitis in my elbow, so I
see. Mm-hmm. Well, this is the thing. Over the phone, it's hard for me to know, but let me ask you something. If you put your arm down on the side of your body and then try to raise it straight up along the sideways away from your body, not forward or back, but just out to the side, straight up. If you do that, is that painful?
No, not, just a hair, but not much.
And if you did that and push against something, like stand near a wall and push the back of your wrist up against the wall and try to push against the wall with the same motion that you just did of lifting your arm up, but now you can't lift it, you're just pushing. Does that hurt worse? Try that.
run to the back of the truck.
Oh.
And push.
Find anything that you can do to push against in that sideways motion.
It's a little bit more than just...
Yeah. So most of the time, pain in this area actually doesn't come from the insertion of the deltoid. It comes from a tendon higher up, and it refers down there, or it comes from the neck. Occasionally, though, it can come from a deltoid. It's just usually the deltoid is not what tears. There's a weaker muscle called the supraspinatus that does the same motion, and that's not as big as the deltoid. And if anything's going to tear, usually it's the supraspinatus that tears first.
Is that spinatus, like spin and natus?
Spinatus. S-P-I-N-A-T-U-S.
Got it.
I think that's how you spell it. And so I'm not sure what's been injured, but you likely have some tendon or muscle injury. But just remember, you can be fooled. Where the pain is felt is sometimes a little bit removed from where the actual tear or the actual injury is anatomically. So it's not always right where it hurts, although sometimes it is. So I guess, and you're on Maui, so I can't see you. I'm trying to think. Usually, if this is a tendonitis, it's very readily diagnosable with a physical exam. You don't even need a fancy MRI or even an X-ray. Just a good, careful physical exam will usually tell us what's doing this. But I can't easily examine. I tried already a little bit to examine you over the phone, but it's ridiculous. So continue to rest it and have it examined and see if somebody can tell you exactly what tendon has been injured, if it is a tendon. And then you can have that treated with various forms of therapy or a shot. 15 weeks is a long time. It's not likely to get better all by itself, is it?
Well, it's getting there, but it's taking way longer than I thought.
Yeah, Allie, you got to try to get some. Sometimes you'll have to resort to seeing a good physical therapist who knows how to do an exam and can do friction massage.
I had a deep tissue massage.
Yeah, that's a little bit different. There's a guy named Soma, orthopedic surgeon over there. He's a sports doctor. He might be able to help you.
I noticed that when I cross my arms to pull up a sweater, it really
you
hurts.
feel it there too. Yeah, I suspect it's not the deltoid, but a structure nearby. It may be, or it could be a joint. It's hard to say, but it's easy to say if I saw you. But
I didn't train that arm, but now I'm starting to slowly train it a little bit because I don't want it to get...
Well, whatever you do, don't do things that hurt, okay?
I won't.
All right, Allie. Good luck with this.
All righty.
Sorry I can't be more precise over the phone.
But, how long you said you're...
I don't know. You know, it's been a lot longer than I would have guessed already.
I know.
So that's what I'm worried about. I need you to get examined by an expert.
I was doing a lot of isometric isotonics because I was lifting light.
Yeah, but that's not the point anymore. Now the point is, what is this?
All right.
That's the main thing. Okay, good luck.
Okay, bye.
Bye-bye. Let's see. Don, go ahead. You're on the air, and thanks for calling.
Good morning. Thanks for taking my call.
You bet.
I'm 76 years old, and I walk about a mile every night.
Good for you. Good.
Sick of doing all that kind of stuff. My knees don't bother me at all.
Nice.
And then I come home, take my shower, and I go to bed and everything. And a couple of hours later, I wake up and my knees are hurting. But they don't hurt when I walk.
Right.
What is that?
So your knees don't hurt you until the next morning?
No, about 2 hours after I go to bed.
Oh, I see. In the middle of the night.
Yeah.
And it wakes you up, or you get up to pee and you feel it when you get up?
No. Once I get up, it quits hurting.
I see. It actually wakes you?
Yeah.
And then you get up, move around, and it's okay.
Yeah.
And what about on the days that you don't walk? Have you ever skipped your mile walk at night to see if it still bothered you?
Yeah, it still bothers me.
It's the same.
Yeah.
And
now, I do have peripheral artery disease. I don't know if that has anything to do with it or not.
Not usually. Usually that will cause pain during walking. So, but do you have any other problems? Do you have diabetes?
No.
Do you smoke?
No.
How'd you get peripheral artery disease without smoking or diabetes?
Well, I haven't smoked for 15 or 20 years.
Oh, I see. You used to smoke.
Yeah.
Yeah, because I never heard of that otherwise. So,
yeah.
And do you have any back problems?
No.
And when you look at your knees, do they look swollen or red or warm to the touch?
No.
Mm-hmm.
I have no symptoms except it just wakes me up and it aches.
And where is the pain precisely? Is it in the back of the knee, the front of the knee, the sides, the whole knee, up the thigh, down the calf? Where is it?
It's the back side and the whole knee.
The back side and also the front?
Yeah, the whole knee.
But not up the thigh or down the calf?
No.
I see. And is it when you're lying in bed and it wakes you up, is it painful to move your knee?
Yes, yes.
And until you stand up, and then as soon as you stand up, you feel better?
Yeah, or if I do a couple of leg lifts.
I see. I don't know what this is, Don.
I don't either.
Sometimes I know. But it could, it's unusual. Most knee problems that cause knee pain hurt with walking and feel better with rest. Arthritis, tendon problems, ligament problems. They mostly hurt when you're using them.
Mm-hmm.
And when you have leg pain in the middle of the night, sometimes that's a spinal problem. And you're fooled because you don't really have any back pain. So you're not sure what the heck is this. My knees I can walk on my knees, but they hurt when I try to lie down and get to sleep. So I need to examine you to find out what goes on, maybe even do some tests. It's not a very common complaint.
No, it's strange because it doesn't hurt when I go to bed.
And have you seen anybody for this so far?
No, not really. I just put up with it because if I do a couple of leg lifts and stuff, it goes away.
Yeah, well, you could see your doctor, but chances are your primary doctor will be baffled because I'm a specialist. I'm already baffled. But if I could examine you and talk to you a little bit more, I could get a good try to figure it out. That's what you need is a diagnosis, and then we could figure it out. So if you want to, you come into town, make an appointment, come into town, and
are you going to be coming out to St. Francis West, out this way anywhere?
Not anytime soon, but yes, I'm on staff there. Because Queens took over, and I'm on staff at Queens, and we're looking maybe to move out to Kapolei, but it's not going to be anytime this year. And I want you to take care of this before the end of the year. So you either see your doctor or come over into town and see me.
Well, I have a doctor's appointment coming up here real soon.
All right, good. So see what he has to say, and if you want, give me a call back in a week or two. We can talk on the air.
Okay, appreciate it.
All right.
Okay, thank you.
Thanks for the call.
Bye-bye.
Bye-bye. I'm going to take my next call in just a second. Ed, don't go away. I want to re-announce my friend Dave Bernstein's 2 seminars coming up in 2 weeks on estate planning. And this is Wills and Trust, and it helps you avoid probate and helps the kids out should you, not if, but when you pass away or become incapacitated. And this isn't just for the old people. Everybody should have a will, especially if you have children or have assets. The first is 2 Saturdays from now, May 24th, at Waialae Country Club, 10 to noon. And then the next day, Sunday, May 25th, at Ala Moana Hotel from 2 to 4. And I've known Dave since the 80s, and he's a smart guy and trustworthy with integrity, so how do you beat that? In order to go to these, it's best if you call, although I'm told you don't absolutely have to, but if you call and make a reservation, 533-3243. I'll say it again, 533-3243. 3243. You can tell them you heard about it on my show if you like. Let's see. Go do that. Do it for the kids. Let's see. I got a call. Ed, go ahead, Ed. Thanks for waiting. You're on the air.
Yes, Doc. Hi. I'm sitting at my computer right now, and I'm looking at this product that they call the Fascianator, Fascianator. And I was just wondering if you heard about it. It's like a hard plastic, well, crudely, it's just like a plastic pipe with some kind of a carpet substance wrapped around. And they're selling it for $65, and it's supposedly something that you lay down on and you roll to kind of relieve muscle aches and pains.
Right. And
I was wondering if you ever heard of it. And
what is the diameter of the plastic pipe? Would you say?
Take
a guess. Is it 1 inch or 4 inches or? 6?
What do you mean the diameter? Oh, the diameter. Well, it maybe about. It's kind of big. Maybe about 3-4 inches wide.
Yeah.
And then it has some kind of a coating around it.
So I know. I haven't heard it called the Fascianator, but we do have these rigid cylinders that are very good to use for certain conditions. I don't know if everybody needs it, but do you have a particular problem that you're trying to treat, or you're just looking to see if you want to do this just for preventative or health reasons?
Well, I have that too, and I also have plantar fasciitis.
Yeah, this is going to be too big to get in and treat the plantar fasciitis. How long have you had that?
Oh, kind of on a chronic situation, maybe a couple of years, I think. I've been living with it just with those orthotic inserts that I get by prescription that I put inside
2 years
the shoe.
Is too long. Have you ever had a shot for this?
Yes, I've had, but it comes back again. The shot gives good
temporary relief.
Good temporary
So
relief.
I'm going to be running out of time in a little bit.
Oh, okay.
Let me. I don't want to rush. I still have a few minutes, but let me say a few things so that we get it said. First of all, this plantar fasciitis business needs to be taken care of, and not with this fasciator. I don't think that's it. The fasciator, it's overpriced, if you ask me. You can look around and get it cheaper, and we use it for people like it when they want to stretch their back or massage their iliotibial band or massage their calf. It's not useless, but it sounds overpriced to me. It's just a cylinder, right? You could just get a pipe.
I'm surprised you charge so much for it. It's just a cylinder with something wrapped around it.
So you could get a PVC pipe at Home Depot.
That's what it looks like.
Yeah, that's all it is. Get a PVC pipe, 3-4 inches in diameter, maybe 2-3 feet long, and then
it's about that.
And if you want, you can wrap it with some carpet or something, or just leave it like that and go for it. Save that. As far as your plantar fasciitis, you should look into other treatments. There's a treatment called PRP, platelet-rich plasma. I do that. When cortisone shots only give temporary relief and you've had it for 2 years, you got to do something else. So I'd be happy to see you for that. That's something that would be challenging, and I'd want to try to get rid of it for you. 2 years. That's right up my alley.
Oh, really?
Yeah.
Yeah, but I mean, it's not like incapacitatingly painful. You know what I mean?
You don't want to live with that if you don't have to.
Okay, Doc. Thank you very much. I'll let you go.
All right. Thanks for the call. I really appreciate it.
Right. Bye.
Bye-bye. Well, let's see. We have another couple of minutes anyway. 521-8383. If you're listening from a neighbor island, you can call toll free at 1-888-565-8383. And let me get one more little plug in for my buddy Dave Bernstein. His seminar on wills and trusts coming up Saturday and Sunday, May 24th and 25th. Call 533-3243 to make a reservation. It's be worth your while. It's not a sales job. This guy is not going to sell you anything. He's going to educate you on how to do living trusts and wills and trusts and so on. It's a big favor you'll do for your family if you can make decisions now and not leave it to them to fight about it and be stressed about it and spend a lot of money with it. Decide how you want to do things now before you can't decide and have to have someone do it for you like a judge. You don't want to do that. So give him a call. I'll announce this again next week. So if you miss it this time, I'm going to try to help him and announce it. Let's see, I have another quick caller. Randall, go ahead. We just got a couple minutes.
Yeah, I just wanted to give an announcement that today, May 11th, is Richard Overton's birthday. He's 108 years old, oldest living war veteran. He served in Hawaii.
And
War II.
And where is he living?
Austin, Texas.
Overton, huh?
Yeah, he was honored by President Obama last Veterans Day at the White House.
Oh, yeah.
Yeah.
Yeah, well,
And
thanks
Governor
for that
Perry.
announcement. Today's his birthday, huh?
Yeah, 108.
Well, happy birthday. Thanks for the thanks
all
for the
right.
call. Very nice.
Well, he said keep busy, keep moving.
Keep busy, keep moving. That was my grandfather, lived to be in his late 90s. And he would go for a walk. He lived in Detroit on the most bitterest, coldest of Detroit winter days. He wouldn't go outside because he couldn't tolerate the cold anymore. He lived in this apartment. He'd walk up and down the corridor outside of in his apartment building.
That's a secret.
And every day he lived to be something like 97.
Yeah.
My Zeta, my grandfather.
That's all people got to do. Keep moving.
That's the name of the show, and there's a good reason for it. The Moving Body. Because that's what I want to keep people doing. That's what I do.
Exactly.
Yeah.
Have a good day.
All right. Thanks for the call.
Bye-bye.
Bye-bye. Let's see. We're just about out of time. I hope you guys enjoyed the show. I just celebrated 27 years on Pi'ikoi Street. I opened in May 1st, 1986. So it looks like 28 years, huh? Anyway, do the math for me, but it's been a long time. And now we're moving downtown. So we'll keep you informed. I got a call that was pretty troubling today. It was a patient who called for an appointment and didn't get a call back. I'd appreciate any more feedback like that because we have some new staff and I'm trying to get things running real smooth. Anyways, everybody have a really great weekend. Happy Mother's Day to all you mothers out there. And I wish I had one. And take care of yourselves. And I'll be back next week, same time. So tune in again. Meanwhile, go out there and move your body. Take care, everybody. Thank you for listening to The Moving Body. I hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back and would like to get an appointment over at the office on Pi'ikoi Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray's normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking shoes and get out there and take a walk every day. We'll see you, everybody. Have a good, healthy weekend, and tune in next week. Bye-bye.